Hello guys, welcome back to No More Cavities. Today we are discussing about stainless steel crown. So stainless steel crown is used when the posterior primary teeth needs restoration. It means mostly the molars. The stainless steel crown is basically known as restoration of last resort. It means it comes at the end. The advantage of stainless steel crown are it is durable, it is ideal because it will be never replaced until exfoliation, and it is less demanding, and the last is it protects the entire surface of the tooth from the attack. So these were the advantage of stainless steel crown.
Indications of a stainless steel crown: multi-surface caries, rampant caries, abutment for space maintainers, bruxism, fractured tooth, after pulp therapy, hypomineralization, developmental defects.
So we will be discussing the technique that how we will prepare the stainless steel crown. So the first step will be local anesthesia. We will give local anesthesia because we will be involving somehow the gingival margin while preparing the tooth. So the first step we will follow will be local anesthesia. Then we can also use topical anesthesia for the gingival cuff. And which type of topical anesthesia we can use? We can use benzocaine ointment. After local anesthesia, we will follow isolation protocol and we will be giving rubber dam. After rubber dam, we will be going for pre-operative radiograph to ensure that the periapical and the interradicular tissue are healthy. Then the fourth step that we will be following will be removing all the caries. What we will do after radiograph, we will see the extent of caries and we will remove all the caries. And we will see if any pulp treatment is required. Then we will use large diamond wheel burr. Large diamond wheel burr for the occlusal reduction. And we will prepare the occlusal surface for 1 to 2 mm. For mesial and distal reduction, we will be using another type of burr that will be fine diamond burr. Fine tapered diamond burr. For occlusal reduction, we will be using diamond wheel burr. And for mesial and distal reduction, we will be using fine tapered diamond burr. We will avoid to prepare any type of shoulder margin. And what's shoulder margin? It is a type of finish line configuration forming 90 degree. So we will avoid that we do not form any type of shoulder margin while preparing for stainless steel crown. Then we will remove all the sharp line angles that are present around the tooth. When we normally prepare a cast crown, the retention and resistance principle of cast crown differentiate from stainless steel crown. How? The cast crown is basically retained by friction. And how this friction come? This friction actually come by preparing the parallel walls. We prepare for the parallel walls. For the cast crown, we prepare the parallel walls. But for stainless steel crown, we do not prepare the parallel walls. What we do, we gain the retention by contact between margins of crown and undercut of the tooth below the gingiva. So, if suppose this is the crown, these are the margins of crown and this is the undercut of the tooth below the gingiva. This thing will give retention to the stainless steel crown rather than the parallel walls. As we are taking the margin for the retention. So under preparation is the most common cause of failure of a stainless steel crown. Under preparation. After trying for retention and resistance, what we will do, we will check the crown and check the fit. Either it is resting on gingival cervix or not. Resting on gingival cervix, what we will do, we will take pliers. And what will pliers do? Pliers will crimp the crown so it can adjust to the prepared position, and then we will seat the crown. After seating, what we will do, we will wash and dry before cementation. The crown will be dried and washed before cementation with GIC. We will take the crown and we will put the GIC on it, and then we will set it on the tooth. And we will set from lingual to buccal direction, and after setting the crown on the tooth, we will remove all the excess material with the probe or dental floss. Then what we will do, we will check the occlusion, and then we will remove the rubber dam.